Just before 5 p.m. on January 12, 2010, a massive earthquake struck Haiti. The damage was widespread and devastating. As news of the destruction began to spread, Sutter Health stepped up to help.
Right away, there was a commitment from the board and from our CEO to commit $1 million to Doctors Without Borders and another $250,000 to MedShare, a company that sends medical supplies all over the world.
For years, affiliates across our Sutter Health network have been working with MedShare to recycle medical supplies so they can be used to care for patients in need worldwide.
We have our MedShare bins conveniently located in our department that allows us to easily recycle things as we are tearing down our rooms. Things such as silastic tubing that's not used. Here we have drapes, which are a very popular item. Bag valve masks that weren't used. Here we had a feeding tube, so it allows us to reprocess things that we haven't used.
Along with the cash donation, we donated medical supplies, and we sent a team ourselves, a relief team of 15 people, to work with Partners in Health. These are doctors, nurses, surgeons, anesthesiologists. At the beginning of the crisis, when the need was just dire over there for medical teams and medical help.
For 7 days, the 15-member surgical team cared for patients at a hospital just outside the Haitian capital of Port-au-Prince.
When we arrived, there were people all over the place. People laying all over the floor on mats and mattresses and sheets and whatever they could grab.
The school had collapsed, and probably 50 kids were buried in the rubble. A lot of them died, but this one was pulled out but was unconscious, and he was put into a coffin. They assumed he was dead. And he apparently woke up in the coffin and started knocking on the coffin, and they rescued him.
At night time, initially when we got there, they would turn off the IVs and not give pain meds, and started to turn that around to make sure the IVs were kept running and that the patients did get pain medications.
In the Haitian community, there's a lot of singing. We would wake up at around 4 a.m. to groups of Haitians walking the street singing. The first patient to receive an external fixator was a boy about 8 years old who actually started singing during the procedure.
We very much tried to focus our efforts on salvaging limbs and creating hope and creating a new life for the patients that we encountered.
Once they sort of got a little bit of trust that we weren't there to, amputate, we were there to try to help them, they definitely started listening, and with the help of the interpreters, we were able to accomplish a lot.
This team is among many employees across our network who traveled to Haiti or even locally donated their own time, money, or expertise to help.
Sutter's ability to provide a donation like this, it only comes from the hard work of all of our employees. And it just made me extremely proud to be the leader of this organization with so many dedicated people wanting to help out.
And helping Haiti is something Sutter Health was proud to do.
What we experienced, certainly as the folks who went, was the best of people within the organization and the best intentions of people within the organization to help. And we're just so happy that we were able to take those intentions and actually do something concrete. And we're actually people with names and with children, and who are alive or who are walking or who are otherwise better off because we did this.